healing. So we are in the Chicagoland area and was kind of wondering, what you guys are experiencing because last week we had 70-degree weather and this week we're in the 30s. Go figure. That's kind of Chicago weather for you. So, and the other day it actually tried snowing. So, yeah, on Sunday we actually had snow flurries. So I don't know what you guys are having, but and then of course with all the fluctuation in weather and things like that, yeah, people were complaining of, sinus issues, joint pain and inflammation. People were getting headaches, and people are just kind of not feeling so good, at least in this part of the country, with all of the weather changes and stuff like that. So, don't know what you guys are like, but so kind of let's talk about like why people have inflammation. Why do you have joint pain? Yes, you might have been diagnosed with rheumatoid arthritis. Yes, you might have been diagnosed with osteoarthritis. But did you know that you don't have to have pain even if you have those diagnoses? Yeah, that's right. And you don't have to have pain and you don't have to take pain medicine. Say what? No pain medicine? But how do you control the pain? Oh, well, let's get into that. So, inflammation. What causes inflammation? So, a lot of times we have inflammation from various different things. A lot of our foods can cause tons of inflammation, including a lot of our grains, especially in the United States. Things like brown rice, white rice, wheat, rye, corn. Corn is notorious. Things like soy. These can actually cause a lot of inflammation, and sugar, refined sugar is another one. These can cause tons of inflammation within the body. And we as Americans consume a lot. And our organic stuff, even organic rice in the United States, I just highly don't recommend it. A lot of our stuff is very, very tainted. It's not organic really anymore. It's less toxic, but it's still not good for us. Causes tons of inflammation. So grains and refined sugar can be a huge source of inflammation. And we know that inflammation causes disease and leads to other things, and it can also cause chronic pain. So, yes, even by and that's not the only thing, it does help. So, I've had some patients where they say, Tracy, I switched to a grain free diet, got rid of my uh, processed sugars, and I still have pain. It didn't work. Because that's not the only thing that can cause pain, and you can have one or more multiple causes of your symptoms. So going grain free is a great start. Okay, getting rid of your refined sugars is a great start. That's not the only thing, and you can have multiple causes. So let's dive into that on why you have chronic pain. So for me, I actually shattered my leg back in 2008. I broke the tibia portion of my ankle, and then I shattered the tibia portion of my knee. I was in a major horseback riding accident. So, and it was so bad that they thought that I would not be able to walk again. Okay. I wound up with a bone plate, a bone graft, and 3 pins in my knee and 2 pins in my ankle. Hello, Judy. We have some Instagram people on. So thank you for joining us. And I think we might have somebody from on either Facebook. So please say hello. Would love to hear from where you guys are at. So wait, what do you mean what? So I shattered my knee and in 2008. By the time I was 30, okay? By the time I was 30, I needed a knee replacement. I was getting knee injections, so arthritis injections every, I don't know, 3 to 4 months. I was too young for a knee replacement, okay? So, yeah, I was in chronic pain. Yeah, you remember, yeah. And then and I I was miserable. I have a whole bunch of bone spurs in my knee still. Okay. Now this is 14 years later. Yes, I'm spitting out my age. I am 44. So 14 years later, I still have not had to have that knee replaced. Now I do walk with a limp because because I apparently I can't walk. I'm accident prone, and in 2021 I shattered my foot. Same leg. We just have to kind of keep everything on the same side. So my foot's actually shattered. And I had a triple arthrodesis. So for people who don't know what that means, is that my foot is basically fused. I can only move my foot up and down. I cannot move my foot left and right because I shattered my foot in another horseback riding accident. So yeah, of course. You would think that I would have learned. No, and I still horseback ride. So yes, I have, my foot's actually fused. So but I'm barely in any pain. Okay, I have enough arthritis. I saw, and when I shattered my foot, I asked them to take a knee X-ray of my knee, and it looks like I have the Rocky Mountains in my knee. A lot of my patients will come in with diagnoses of arthritis, of rheumatoid arthritis. And after a while, they no longer have pain or it is very, very minimal. Now, granted, there are some days where my foot does hurt, depending on how much walking I'm doing. Because again, my foot cannot compensate, it cannot move. So the bones are kind of like basically fused together. So my bones cannot, like, adjust properly when I walk. So they cannot compensate for different surfaces underneath my foot or for weight changes depending on how I walk. So, of course, it's going to be a little bit sore that I'm not gonna be able to get rid of. But on a day to day, it's barely sore. My knee doesn't hurt at all, okay? Unless I shouldn't say that on day to day stuff, but if I twist too fast, if I like do a quick sudden turn, or if I exercise and I strain my now I still horseback ride. I can jog a little bit. I walk a lot, but I'm talking about like squatting. So if I go too low, then my knee does hurt a little bit. Um but I can still squat. I just have to be careful on how low I go for squatting. So there are certain activities that can irritate my knee, but for the most part my knee it does not hurt. Okay. Horseback riding does not bother me. Um, I can walk a fairly long distance. I can walk for an hour, and maybe by the end of walking for an hour, then my knee is a little bit sore. My foot's a little bit sore, and that's rightfully so because I've walked for an hour. But for the most part, on day to day stuff, I do not have any pain. And the minimal pain that I do have does not keep me from doing activity. And I have not had to need knee replacement, and I don't plan on needing a knee replacement. Um, so how does that happen and why do patients feel better? Well, we want to find out the root cause. So yes, you have arthritis, but there's also other factors that cause inflammation. We want to find those out. And a lot of times things like Lyme and the co-infection, so that means little bugs that hop on the ride, of the same insect that bites you. So Lyme disease is usually found, well, they say just from ticks, and that's not true. Any biting insects, such as mosquitoes and spiders, can also carry Lyme disease. So, a lot of patients can have Lyme and not even know it. Well, co infection is similar bacterium. So, Lyme disease is a bacterium. So, there's other bacterium that kind of hop along within that insect and is usually seen with the actual Lyme disease, Lyme bug called Borrelia. Okay. And these kind of hop along and you can get an infection with this. So this is called a co-infection. So Lyme disease and undiagnosed Lyme disease can cause tons of joint inflammation and pain. And I see this a lot with my patients. So unexplained back pain, or even if you did see, a doctor and they say, oh, you have arthritis in your back, or you have arthritis in your hips, or you have hip pain or knee pain, or it's bursitis. What is causing the bursitis? Again, we want to find that out. Plantar fasciitis. I see a lot of Lyme and Lyme co-infections causing plantar fasciitis. So again, what is the underlying cause? So rather than taking that ibuprofen, so yes, you might need, an ibuprofen, you might need an anti-inflammatory. There's other healthier ways and other healthier anti-inflammatories until you get rid of the underlying cause. but let's find out the underlying cause. So Lyme can be it. And Lyme also causes a whole bunch of other inflammation. So it's not just in the joints, it can cause inflammation in your gut. So a lot of patients with IBS type symptoms, acid reflux, um, can also have Lyme disease. That can be it. They can cause thyroid issues. Okay. So inflammation within the thyroid gland. So think Hashimoto's. Okay. Hashimoto's is an autoimmune. Do you think that your body is actually attacking itself, or do you think it's attacking something within that organ? Okay. So Lyme can also cause tons of hormonal imbalance. Okay. So joint pain, hormone imbalance. So if that describes you, guess what? You could have Lyme. And the problem is that a lot of people get misdiagnosed or it's missed completely because when you do blood work, they check for antibodies. And if you do not have an antibody, then they say you don't have Lyme. So what happens is either you ran out of antibodies or you never produced them in the first place. That doesn't mean that you don't have Lyme, you just never produce the antibodies. So you can have all these symptoms, and that could be the underlying cause of why you have your symptoms. Okay, so though that's one reason why you have joint pain and inflammation. In our practice, we see a lot of heavy metals, lots of heavy metals and heavy chemicals. Where do you get the heavy metals and heavy chemicals from? A lot of things. Take a look at your food that you eat and all the processed foods. Take a look at your ingredient list. A lot of those are chemicals and preservatives and heavy metals and toxins. Look at the back of your ingredient list on your shampoo bottles, on your makeup that you like, on the deodorant that you like, on the body wash that you like. Mm, mm, Excuse me. So these can actually cause your body to absorb heavy metals and heavy chemicals. Excuse me. Gotta love LaCroix. So this is where we get heavy metals and heavy chemicals. These are hormone disrupting. Okay, so they cause a lot of hormone imbalance. Some of them are cancer causing. And a lot of these heavy metals actually have an affinity to soft tissue. So, including the cartilage in our joints. So, I see a lot of heavy metal toxicity causing a lot of joint pain and inflammation. Got to get rid of that. So, diet change, finding out the underlying cause. So, toxins, heavy metals, Lyme disease. Okay. What can you take? Well, so over the counter stuff, again, what we do is we muscle test, but some of the over the counter stuff may or may not work. You can try bentonite clay. You could try activated charcoal. Those are binders. They can help bind to heavy metals and heavy chemicals. You know what I love is a product line called Cellcore. Cellcore has some of the best binders out there to remove heavy metals and heavy chemicals. So one of them is called Virad Chem binder and let me see if I have what bottle, and I do. So this is Virad Chem binder from Cellcore. It might look backwards to you guys. Um, but Cellcore, this one helps with viruses, radiation, and heavy chemicals, and it's a binder. Okay, so it will bind to heavy metals. So sometimes we have to use a combination of a binder and a chelator. A chelator helps to draw out toxins from tissues and from organs, okay, and from glands. So sometimes you need a chelator and a binder. Just depends on the person. And we will muscle test to see what your body actually wants. So some good chelators can be cilantro, um, chlorophyll, or chlorella can also be a good chelator as well. But again, it like we use concentrated forms because you'd have to eat a ton of cilantro in order for it to really do a job as a chelator. Um, but we want to get to the underlying cause. So heavy metals, heavy chemicals, foods. We talked about Lyme, and last but not least is parasites. Parasites can completely cause a lot of pain and inflammation. So parasites can actually live inside of joint capsules and tissue, and they can actually encapsulate themselves and form cysts. I talked about this before, and it's actually on the CDC website where parasites will form a cyst around themselves to protect themselves, so that way they don't get killed by your body's defense, mechanisms. And so think of Baker cysts. Baker cysts are cysts that are formed behind the knee. Those could be parasites, actually. Actually, any form of cyst in the CDC actually recognizes this too, is any cyst can be a form of or can be a parasite, because parasites will form cysts. So brain cysts, breast cysts, okay, kidneys, ovarian cysts, uh uterine, okay. So joint cysts like Baker cysts, these can all be from parasites. So we want to find out, why do you have your pain and inflammation? And another key thing is if you have pain and inflammation and it is worse within the week of a new moon or the week of a full moon, or any of your symptoms are worse within that same week of a full moon or new moon, chances are it's actually related to parasites. Parasites are more active around those times. So that means that your symptoms will have a flare up. So pay attention to when your symptoms are worse, and if it's and the moon cycle, because that could be a very, very big indication that you might have parasites, and parasites might be the underlying cause of why you have symptoms. Not only that, but parasites actually give off waste material, so ammonia levels. So basically pee and poop. So, and those waste materials cause tons of issues within the body, including overall inflammation. So, brain fog. Okay. So, you have gut issues, you have brain fog, you have joint pain, inflammation, you're tired. Good possibility it's parasites. And I've actually seen people have parasites and Lyme disease all at once. Yay for them. So, and there's a way to find out exactly what supplements your body specifically needs to handle this. Some other things like wormwood, clove, um, pumpkin seeds can be good for getting rid of parasites, but a lot of times you need several different combinations and a lot more than what people actually think they need to get rid of parasites. And the process is actually a lot longer. So a lot of your over the counter stuff for parasites cleanse is like a 10-day cleanse or 14-day cleanse. Guess what? That's not long enough. You are not going to get rid of all of your parasites just by doing a 14-day cleanse. It can take months for you to fully get rid of parasites. That doesn't mean you're not going to see anything being expelled from your body. You will, but you're not going to be done with them. So it can take months for you to get rid of parasites. And then it's an ongoing thing. People should be doing a parasite cleanse minimally 2 to 3 times a year. Same thing with heavy metal and heavy chemical cleanse 2 to 3 times a year, because you're never going to stop getting exposed to parasites, and you're never going to stop getting exposed to heavy metals. That is part of prevention. Okay. So it is like getting your oil change in your car. So you do that to keep your oil clean, so that way your engine can run smoothly. You need to be doing that for your body as well. And then what I like about with quantum nutrition testing is we can find out exactly what is the underlying cause, and then exactly what supplements your body specifically needs. And this can be done virtually and or in person, which is quite amazing. I am flabbergasted every single time I do this and I work with patients, because if you had told me 10 like 10, 15 years ago that I would be doing something called quantum nutrition testing, and I would be seeing patients virtually and helping them heal naturally as a cardiac nurse, I would have said you are out of your cotton picking loving mind. I would have. And I would have thought that the whole stuff was a whole bunch of hocus pocus and a whole bunch of voodooish. I really thought it was. I was so engrossed in Western medicine at that time that I didn't think that, anything else worked. And well, actually, that was more like 15 years ago. And I was sorely mistaken and found out that this stuff actually does work and that this really has helped a lot of patients. I've been doing this since 2015 now, and I got certified in quantum nutrition testing about a year and a half ago, and that has allowed me to see patients virtually. So, and I help patients now across the country, in several different states, all the way from Florida to uh, Iowa to Michigan to Wisconsin, just to name a few. And I'm in Illinois, and I've never seen they've never stepped foot in my office. So pretty amazing stuff. So if this sounds like something that you're wanting more information, or if you have, or you're tired of the joint pain and inflammation, please give us a call. Because w- what does chronic pain and inflammation look like? So yes, you might be taking care of it with medication. But what are the side effects and what are the long-term problems? Stomach ulcers, bleeding ulcers, gastritis, kidney issues, other pain medicine can cause liver damage. That doesn't sound like fun. You don't want permanent kidney damage from taking all these pain and anti-inflammatories. You don't want liver issues. And I don't know about you, but if I don't need a knee replacement and if I don't have to go under surgery for that, I don't want surgery. I don't know about you, but that doesn't sound like fun, And then if you still don't get that handled, you know, what's it going to be like when you're older? Everybody wants to have a good quality of life. You want to be able to be active. You don't want to have to worry about, oh, am I going to be in a wheelchair? Am I going to have to use a walker? Am I going to have to use a cane because I'm in so much pain? Am I possibly going to be bedridden? These are real serious things. And you might not have it now, but if you don't get to the root cause and you don't handle some of this stuff, what is it going to be like for you 10 to 15 years from now, even 5 years from now? So, just some food for thought for you guys to think about. And whether you do something with me, seriously, seek something other than just popping a pill and surgery because I promise you there are other and healthier ways. What I like about this is, and not all muscle testing techniques are created equal. I will tell you that as well. I am, and I'm not tooting my own horn because I there's plenty of my colleagues out there that have been certified in just as many techniques, and they are fantastic and phenomenal. But not all muscle testing techniques are created equal. I have seen some patients where they don't believe muscle testing works because they have seen somebody who does muscle testing and they said, well, it never worked for me. And I said, okay, well, what did that practitioner do? And they said, well, the muscle testing technique was, they just put a couple supplements in my hand to see if it worked. I said, well, was that to support your thyroid? Like, for instance, and they said, well, yeah. I said, well, that's good that they gave you supplements to support your thyroid. Did they ever get to the underlying cause of why that thyroid is not functioning properly? Oh, well, no, it was just a supplement to support my thyroid. Okay. Again, we want to get to the root cause. No wonder why you didn't get that good of a result because it was never handled in the first place. So again, all muscle testing techniques are not created equal. You want a practitioner who knows how to find the root cause, find out what supplement your body needs, what company is the best for you. I use several different companies and there's a way for me to actually find out which product line is the best one for you. And then you want not only that, but then the practitioner to be able to tell you how much does your body need? Because it's not what the bottle says. If I did that, then I'm putting you in a category and I'm saying that every single person works the same way. And not every single person's body works the same way. Each body is individual. So I might want, I don't know, I'm just going to name this off in my head. So like I mentioned Viride Binder earlier. So let's say you and I both want Viride Binder. We both test really well for this. I might only want one capsule. Maybe your body wants three. There's a way for us to actually find that out. So it gets very specific to what your body actually wants and not necessarily what the bottle says, but what does your body want? So you want a practitioner who can actually be able to do that, to find out the underlying cause, what supplement your body wants to handle the underlying cause, and what supplement your body wants to support that organ that is stressed out. And then to find out how much does your body want of each supplement. So it's a very, very tailor-made program for you. So if that sounds like something that you're interested in, please give us a call, 708-554-6730. Otherwise, look up quantum nutrition testing. It is, there's other practitioners that are available. But yeah, hopefully that kind of helps you guys out and have a wonderful evening.